quickly introduce them and then let them go down the line and share their thoughts on what makes LGBT healthy and what we're doing in DC for healthy, to make LGBT healthy. Starting to my right, we have Brian Watson from Transgender Health Empowerment and the Wanda Austin House. We have Andrew Barnett, the Executive Director of SMILE. We have Diana Bruce, the Director of Health and Wellness at the Office of Youth Engagement of DCPS, DC Public Schools. And we have Susan Blake, an Associate Professor in the Department of Prevention and Community Health at GW? Yes, that was right. So why don't we go right down, it's good with you guys, why don't we go right down the line and we'll start with Brian to share some of your thoughts.
You said two things.
What makes LGBT healthy in DC and what we're doing to support that.
Okay. Well, good evening to everyone. My name is Brian Watson. As David said, I am Director of Programs at Transgender Health Empowerment / Wanda Austin House. We are actually the largest transgender organization in the country, founded by African American transgenders to serve primarily the transgender population, but we serve everyone in the LGBT community. I guess first off, I'll start off by saying that, at Transgender Health Empowerment, we operate a drop-in center Monday through Friday. And in our drop-in center, we often see homeless individuals because of the services that we provide, which is laundry services, use of computers. We provide meals daily as well as laundry and showers. And a few years ago, we saw a great increase in homeless LGBTQ youth in accessing the drop-in center. From those young people accessing the drop-in center, the one Austin House was started, which is a housing program for homeless LGBTQ youth. Then I said, okay, we're doing this, providing housing and stuff. So then I started to see some other issues. We started to see some other issues. We added on services such as HIV treatment adherence, counseling testing, and things like that. Because we started to see young people come into our drop-in center, as well as young people in our housing program that had various health issues. They were contracting STDs, they were contracting HIV and AIDS, even contracting hepatitis. We have a large transgender population who often engage in sharing of needles or silicone or hormone injection. So we started to see a whole lot of health issues, which we still see. The greatest concern that I see working with the population that I work with is a great increase, in HIV and AIDS among young Black men or young MSM, which is an issue that we definitely have to address. And then in the older transgender population, we're starting to see, cancer. So we have a wide range of issues that we're seeing in the community, but again, when it comes specifically to LGBTQ youth, seeing those issues in dealing with young gay men and MSM is definitely a concern to me. I think we're doing good where we have a lot of services here, a lot of agencies. We have Whitman-Walker, we have places like that. But for some reason, we still have young people who are either not using condoms on a regular basis, don't know who, they're not having, a lot of relationships, not quite sure what the issue is. And so that's something that, I definitely feel passionate about that we're addressing. We're trying to address that at THE and the education that we do with youth. Sadly, I don't have a whole lot of statistics and things to give you around transgender youth because there's not a lot of data out there when it comes to transgender youth. So what can we do better? We can get data on transgender youth. What we can do better is do more outreach because some of the people here, I'm sure, will talk about YRBS and other studies and things like that. But, you know, the kids that I see, you know, we see at THU, other kids who are not normally going to school on a regular basis. So those are young people that, you know, are not, you know, taking these surveys and we're not getting data from. So we need to do aggressive outreach, you know, with other organizations, not just, you know, GLBT specific organizations, but, you know, the Covenant Houses, the Black American Youth Centers, the Sasha Bruce's, you know, who see homeless youth on a regular basis, because that's the only way that we're going to get grips on exactly how big the health issues are around LGBTQ youth, is if we, you know, try to canvass the whole area. So I'm just going to say that as of right now, there's just some of the things that I think